to news around COVID-19 now. Concern is mounting over the number of infections and deaths South Africa is recording on a daily basis. And in particular, worry is for the KwaZulu-Natal province. The province's numbers are rapidly rising, and at some point this week it recorded almost 6,000 new infections out of 11,800 in the country. We are joined now by Premier Sihle Zikalala via Skype. Now, Premier, thank you very much for your time. You're live on eNCA. Now, healthcare workers are increasingly testing positive for COVID-19. Some of them are actually even losing their lives. Is the KZN province's public sector and public hospitals coping?
Yes, thanks for having us in your program. We are quite worried about the state of affairs. The increase in the number of healthcare workers who are getting infected. But I can safely say that our healthcare system is still having sufficient capacity to handle the situation. While we cannot undermine the fact that even if it is a single healthcare worker, we get affected. And in this case, we are talking about a number of people who have dedicated themselves into the service of the nation who get infected. But we have a number with bed capacity. We still have capacity in terms of the staff, but we are also trying to ensure that we look after those who get infected so that they will recover as soon as possible.
What about infrastructure and shortage of equipment, for instance? We spoke to Denosa about an hour ago on this show here on eNCA, and they were saying that equipment shortage is a problem, infrastructure is a problem. eNCA also had its own program that showed, for instance, the Addington Hospital is in dire need of an infrastructure upgrade.
Of course, there are old hospitals like your Addington Hospital, your King Edward Hospital, where the infrastructure is old and it needs to be upgraded. If you will talk about Addington, we must admit we have lifts that are not functional, and there are very few that are functional. We are attending to that, and the department is working around the clock to ensure that that situation is addressed. But in a number of hospitals, the situation is fine, the conditions are good. The Denosa and Nehau are part of us, and we are working as a collective in ensuring that we intervene in all areas where there are problems. We must not also be defensive as government. None of us ever expected that we will be hit by a pandemic of this nature. And therefore, our healthcare system may be taking time to respond sufficiently to what is envisaged, but it is not a fact that it is cracking or facing challenges. We might not have reached a high level because of obtaining challenges such as the old infrastructure and others.
Now, we've had a first wave before in winter of 2020. Now we're in our second wave, and obviously there's a lot of concern. Would you agree with some critics who say that government had time to make sure that the health system is more ready, that infrastructure development, for instance, is made a priority and has wasted time in terms of that? Now COVID-19 seems to be showing the cracks.
And that point is only advanced by the critics who do not want to get into the situation and be involved. I must start by saying, during the time of the first wave, we responded. We even built the temporal infrastructure in a form of your field hospitals. And thereafter, we realized that no, we were not experiencing the high number of admissions, and that was countrywide. And then some of that infrastructure had to be taken down, and we had to get out of agreements that were established with some of those service providers. Even the AG went to an extent of saying the infrastructure that was installed during the first wave was not necessary. So that compelled government to withdraw that And all of a sudden, there is this second wave, and we are trying to respond to that again. We are now re-establishing and repurposing some of the hospital to meet this challenge that we are facing.
People would say that the government is very reactionary, Premier, to what you've just alluded now. But also, do you know how many people are admitted in your hospitals in KZN and how many are in ICU in particular?
We do release those reports. We know how many people are admitted. As we have said that by yesterday we had about 6,000 cases. But we know that in terms of the ICU bed, we have more than 50% capacity to handle the ICU patients. And we know that we still have a capacity. We have repurposed more than 540 beds, especially for eThekwini, iLembe, and eRigwala. We are still well in Umgungundlovu, so our affected areas are covered. Yes, the number of admissions is increasing, but the capacity is still there.
Premier, I want to move from one pandemic to another. We're moving now from the coronavirus pandemic to the violence pandemic, if I can call it that. In KZN and Shallcross, we told the story of 2 people being beheaded in a suburb of Shallcross in broad daylight. KZN has a history of violence, taxi violence, for instance. There's also the political killings that have been taking place there. What are we doing wrong? What is it that KZN needs to do to improve?
I think mentally what we need to do is to uproot and deal with the culture of violence, a culture of solving problems through violence. We need to deal with that in a dedicated approach that will inculcate the values of Ubuntu, but also understanding that we must be proactive in dealing with problems. For instance, the problem of Shallcross needed a situation where we deal with the issue of drugs and drug lords, and that is what we deal with. Also, for communities to take the law into their hands was uncalled for, and what they did was quite bad.
Have you spoken, for instance, to the Minister, Begicele, about what happened in that province this week? Probably this is something that needs national attention, coming to, for instance, vigilante attacks as well as drug issues in the province.
Of course, we are in touch with the Minister, hoping that he will be with us soon to deal with that situation. He is, of course, working with us through the SAPS to ensure that they give us the support, and I'm sure that that case is going to get a serious and intensive investigation.
Well, thank you very much. That is KZN Premier Sihle Zikalala speaking to us there about issues facing his province.